I am now pleased to introduce our first speaker, Dr. Susan Clayton. Dr. Clayton serves as the Whitmore Williams Professor of Psychology at the College of Worcester in Ohio and a visiting fellow at the Paris Institute for Advanced Studies. Dr. Clayton's research focuses on examining people's relationship with the natural environment, how it is socially constructed, and how a healthy relationship with nature can be promoted. She has written extensively about the effects of climate change on mental health and about climate anxiety. We're so honored to have her with us today to help us understand how climate change impacts mental health. Dr. Clayton?
Great, thank you. Thanks to all of you who are here, and thank you for the opportunity to discuss this important topic. What I'm going to do is outline the ways in which climate change can affect mental health. I'm going to describe some of the different ways in which it can do that. And I'll say a little bit about how I think we can respond in a way that will preserve and promote mental health, although you will certainly hear more about that from the remaining speakers. So Ryan, if you go ahead and move to the next slide. I think we are all increasingly aware that climate change is something that's affecting us as humans. It's affecting us economically. It's also affecting our physical health. But it's less obvious to a lot of people that it also affects our mental health and well-being. And there are essentially 4 channels that I'll describe through which you can do that, maybe in order of obviousness or lack of obviousness. It can have an effect because of the ways in which climate change is affecting mental health, acute events. It can have an effect through the chronic changes that are a part of climate change. It can affect mental health through the indirect consequences. And then there are these essentially vicarious or perceptual impacts of climate change. And I'll talk about those one at a time. Next slide, please. So natural disasters are something we're all aware of. Many of us have experienced and certainly read about the effects. And I think it's very clear that it can be a very difficult, challenging, and traumatic experience to live through a natural disaster. So not surprisingly, natural disasters are associated with increased threats to mental health. And we know this from decades of research. Before people were really even thinking about climate change, we knew that extreme weather events did have an effect on mental health. They tend to increase rates of post-traumatic stress disorder, depression, anxiety, lead to increased rates of suicide, substance abuse, even sleep disorders, and even domestic abuse and interpersonal violence tend to increase for people who have experienced an extreme weather event. And these events or these impacts don't necessarily resolve within a few days or a week as the natural disaster, as we begin to recover from that disaster. Instead, they can persist for months and even years. Next slide, please. So, next slide, Ryan. I'm not seeing the next slide. So, society can help us protect mental health in response to these kinds of impacts. And one of the things about mental health is that it's not determined. It's not just a clear cause-response effect. There's a lot of room for things to magnify or minimize the impact on mental health. So society can do a lot. And one of the things it can do is to give people adequate warning about impending extreme weather. Something I think we're seeing more of, but there's still lots of room to improve on that. And when I say inclusive, we need early warning systems that actually are accessible to all kinds of people, including, for example, people who might be hearing impaired or who don't have access to the internet. We need more support for mental health services. We need this kind of support in general, but particularly after disasters, and there are ways in which societies can facilitate that support, often by training people who are not necessarily mental health professionals, but can be trained to give that kind of early psychological first aid in response to the impacts of the extreme weather. And I think we also need to be thinking about nature-based solutions. In other words, the extent to which there's an impact of an extreme weather event, such as a major storm or a wildfire, can be mitigated somewhat by design solutions that might reduce the impact of flooding or reduce the impact of the wildfire. And that will, of course, serve to protect mental health a little bit as well. Next slide, please. The chronic changes that are part of climate change, I think, are less frequently thought of, in partly because they're less dramatic. We don't see them because the changes are subtle and day-to-day, but we know that gradually heat is increasing. So are things like sea levels and even decreased air quality is associated with climate change. And many of these things can have impacts on mental health, but I want to particularly highlight the impact of heat because, again, we have lots and lots of research highlighting the fact that heat has a negative effect in all kinds of ways. Heat has been shown to be associated with increased rates of suicide as well as psychiatric hospitalizations. It also just makes people grouchy, and I'm sure many of you can attest to having experienced that yourself or in those you love. It tends to decrease our mood, which of course in turn has an effect on social relationships. People are more likely to get into arguments and fights when the temperatures are high. And that of course can have an effect on mental health. And even cognitive functioning, we're less able to concentrate. People's ability to do their work at school tends to be impaired by high temperatures. So something we very much need to be aware of as we think about climate change. Next slide, please. Again, there are things society can do to help to head off some of these impacts of higher temperatures. Once again, nature-based solutions are an option, and tree canopy is a surprisingly simple and effective way of reducing the levels of heat. And this matters because, well, it matters for all kinds of reasons, but one reason it matters is that poorer neighborhoods are likely to have fewer trees nearby, so they tend to actually be hotter than richer neighborhoods, meaning they're more exposed to those impacts on mental health. It's also important for communities to set up cooling centers where there might be free air conditioning for people who do not have access to air conditioning in their homes. And so the idea of an inclusive safety net that's mindful of the fact that not everybody has access to trees, not everyone has access to green space or to air conditioning. Next slide, please. The indirect effects of climate change are actually some of the ones that are going to be most powerful. And I'm not going to go into detail except to say that food insecurity is one of the major ways in which climate change is likely to impact human health, and mental health is affected by food insecurity as well. So there's good evidence that malnutrition can have impacts on your mental health, and those might, if you experience malnutrition as a child, that might extend into adulthood. Many people are displaced by the effects of climate change. Their homes might be flooded, or because of changing patterns of precipitation, they're no longer inhabitable, so they have to go someplace else. And we know that involuntary displacement is a major hazard for mental health. Next slide, please. So in response to these indirect impacts of climate change, I think society needs to be thinking about how to mitigate those, how to head some of them off by encouraging people in some cases to change agricultural practices so that food harvests are not as seriously impaired by the changing climate, encouraging people to eat in a healthier way that maybe does not require as many environmental resources. By helping with community migration. And one of the things I mean about that is helping a community to, if necessary, if the community is displaced, to move together rather than piecemeal, because maintaining those social safety nets are really important to mental health. And acknowledging the importance of place so that how people's mental health might be impaired if their place is threatened. Next slide. And I really want to stress something that's been getting a lot of attention in the news in the last year or so, which is the idea that we're responding not just to the effects of climate change, but to the perception of it, to the awareness of it. So these quotes show you some of the ways in which people's kind of understanding of the world has been affected by their experiences of climate change. They're hurricane survivors who are saying that everything is temporary, that they don't feel real, that home doesn't feel like home. Those are very powerful emotional responses. Next slide, please. And we tend to see around the world rising levels of anxiety as people, again, around the world are increasingly concerned not only that climate change is happening, but they will personally be harmed by it. And so I put up these results from a Pew Research survey from last year showing that you do see a lot of variability, but in every country studied, more than half of people are at least somewhat concerned about the personal impact of climate change. And in another study that was done last year, 10,000 young people surveyed around the world, 45% of them reported that their worry about climate change was having a negative impact on their daily functioning. So these are levels of anxiety that are really beginning to impair people's day-to-day lives. Next slide. And as I kind of hinted at earlier, not everybody is equally affected, and this is important as well. Some groups are at greater risk of the effects of climate change, including mental health impacts, than others. Next slide. So you see vulnerability due to, of course, geographic location. If you're located in a coastal area, you're more subject to coastal erosion. If you're located in an area that's prone to wildfire, you're more affected by that. But also the lack of financial resources can make people vulnerable. Social marginalization and discrimination can make people more vulnerable. For example, we know that there's a history of people from ethnic communities being essentially steered to less desirable areas to live in through bank lending practices, for example. So they might end up in areas that are more vulnerable to the effects of climate change. And even physiological factors can affect your vulnerability. Next slide. So among those groups that might be affected, might be particularly affected, women are sometimes more physiologically vulnerable, particularly during pregnancy, but also their social role can make them more vulnerable to the effects of climate change. Women are primarily responsible for caregiving in a lot of families, which means that they are looking after other people, which gives them more responsibility in the case of an extreme weather event. They also, in many cases, have less access to financial resources or informational resources that would help them protect themselves from the effects of climate change. People with pre-existing health conditions can be more vulnerable, partly because of the fact that if their medical supply, and including psychotherapy, if their access to that is disrupted, that can be particularly harmful. But also their health conditions or the medications they're taking, perhaps for mental illness, may make them more vulnerable to high temperatures. We know that elderly people are more vulnerable to high temperatures. And I want to highlight in particular Indigenous peoples whose mental health is particularly vulnerable to changes in the environment because of the cultural history of relationship to the natural world. And on the next slide, I want to highlight that children are particularly vulnerable, again, for physiological reasons, because their bodies are still developing, therefore it's kind of easier to disrupt their systems, including their nervous systems. They show greater prevalence of mental health impacts after an extreme weather event, and their learning may be affected. Their behavior may be affected, their ability to regulate their own emotions in ways that are in some cases long-term or even permanent. So next slide. The last point I want to make is that although it's very important for society to respond to these threats, individuals can respond as well. And I think it's important for us all to think about how to react to climate change. Individuals can be helped to learn how to regulate their own emotional response so as to not be overwhelmed by climate anxiety. They can benefit from increased social support, And that's something that people can try to build for themselves is more supportive social networks. A sense of optimism is important in kind of maintaining mental health in the face of climate change, as very importantly is a sense of efficacy, a sense that what you do matters. And finally, behavioral engagement will not only help to perhaps mitigate the impacts of climate change, but also increase an individual's ability to be emotionally resilient in the face of the mental health impacts that climate change is bringing. And I'll stop there. Thank you for your attention.
Thank you so much, Dr. Clayton, for sharing the human impacts of climate change and highlighting how individuals and society can respond.